Thank you for joining the Population Health Innovation Lab, lovingly known as PHIL, for the first session of our three-part series, Improving Population Health through Multi-Sector Collaboration. Today's session is Secret Sauce for Aligning Sectors, Top 3 Things to Do when Aligning Systems for Health. Next slide. So just so everyone is aware, you should have been notified by Zoom just now too. This event is being recorded and the recording and slides will be available on the PHIL website. So to start us off, I'm going to pass it to the director of PHIL, Sue Grinnell. Sue.
Great. Thank you so much. We are so excited for today and to be with all of you, and just grateful for you being and learning with us today. And this event represents a culmination, but it's not the end, right, of a lot of work that some of you have been involved in, and really just demonstrates our commitment and your commitment, right, to the work of Multisector Collaborative and in our work with and for communities. So we're grateful, right, to have had this opportunity to learn with you. And this is hard work, like it's not easy, and so excited to share with you today. So here's a bit about our time today. So we're just going to do a really brief introduction to who PHIL is. You're going to hear from Stephanie Bultema, right, who's going to provide a research project overview around the aligning systems for health with ACHs. And what you're all like very excited about, right, is what are those top 3 things, right? There's many, but kind of honing in on the top 3 things when aligning systems for health. We are going to have time for questions at the end. We are opting not to do breakouts, right? So we're just going to have an open dialogue for everybody to be together. And our objectives for today really is that when you leave here, you'll be able to, recite what are those top 3 things to do when aligning systems for health, that you will be able to explain why those are important, those top 3 things, and provide at least one example for how each of those could be done. Next slide. So we at PHIL feel it's very important to start in all of our work with a land acknowledgement. And a land acknowledgement is really a simple and a powerful way of showing respect and inviting in and honoring the truth. So we want to begin today by acknowledging the Indigenous peoples of all of the lands that we are on today. We're on a virtual platform, and I just want to acknowledge the importance of the land that we all call home. And it's really done to reaffirm our commitment and our responsibilities to improving relationships between nations and into improving our understanding of local Indigenous peoples and their cultures. And in the chat, we provide a link to a map where you can identify the tribes if you're not aware and just know about the tribal nations. I also think it's important today to just name that it is one act, but that there is also this notion of going beyond land acknowledgement. And we also offer a guide for those of you that are interested that is called Beyond Land Acknowledgement. And it's just one step, right? It's not, as acknowledging, but there are other things to think about doing, considering doing, being in dialogue with your community about ways that you can go deeper, right, in terms of our relationships with tribal nations. Next slide. So just briefly, a little bit about PHIL. We are a program of the Public Health Institute, and we love and really are just really here in support of health-focused multi-sector collaboratives. We've done a lot of work with ACHs, but also are really interested in health-focused. So the things that are listed here are things that we believe we have some knowledge, wisdom, and expertise to be able to offer, and just want to call those out. And today is one example, right, of work that we've done. Next slide. So with that, let's get to the main course here. Stephanie Bultema, who I'm so excited to work with. She actually started working with me on this project in, was it May of 2020? Crazy times. Crazy time. So with that, I am going to turn it over to Stephanie. So thank you.
Thank you, Sue. Hi, everyone. Good morning, good afternoon, wherever you are. My name is Stephanie Boltema. I'm director of Merlin and Phil. Merlin stands for Monitoring, Evaluation, Research, and Learning Innovation. So all things data is what I get to focus on day to day. But today I'm really excited to share findings with you all from the Aligning Systems for Health research that we've been conducting the last few years. So to start off with, I want to do a round of acknowledgements. First, I want to acknowledge that funding for this project was made available through Aligning Systems for Health, which is led by the Georgia Health Policy Center with support from the Robert Wood Johnson Foundation. And I also want to acknowledge that this research wouldn't be possible without the incredible support of countless organizations and individuals. Foremost among those are the 22 accountable communities of or for health, also known as ACHs, across Washington and California, who contributed their valuable time, expertise, knowledge, experiences to make this research possible. I also want to give a huge shout out to the Phil team. So all of the beautiful faces that you see here played a key role in this research in some way. And this research would not be possible without all of these people as well. Thank you, Phil team. You all are amazing. So now let's dig into the secret sauce for aligning sectors, the top 3 things to do when aligning systems for health. I want to just provide a disclaimer up front that this is incredibly simplifying really, really complex work. And so I just want to acknowledge that up front. But what we've also heard from many of you, from ACHs, from an amazing thought partners group that helped us decide what are we going to do with all this research, that really y'all deal with so much complexity day in and day out, that one of the biggest gifts that we could provide to you all from this research is not a report or a journal article or a dissertation. It is a simple list of just a few things that are really important that came out of this research. And so that is what we are trying to do today, is to cut through the complexity and just share a few things that if you're going to focus on nothing else, these are the things that we would ask, that we would request that you make sure to prioritize some time and dedicated resources to. So before I get to those 3 things, I want to make sure that everyone is on the same page about how we got to these 3 things. And so I want to provide a little bit of background on the research itself. So this research project we call Aligning Systems for Health with ACHs. And the goal of this research was to explore how collaboration and alignment among public health, healthcare, and social service sectors, in partnership with community residents and tribal nations, leads to outcomes in 22 accountable communities of or for health, or ACHs, in Washington and California. Now, since all of you may not be familiar with this term ACH, I want to make sure to spend a little bit of time here. So here, I mean, ACHs are health-focused multi-sector collaboratives. I realize that some people also might not be familiar with this term, multi-sector collaboratives, so I'll hop to this next. But these health-focused MSCs create shared responsibility and accountability for the health of a community. The figure that you see on this screen was created by the Funders Forum on Accountable Health, and it does a really nice job of summarizing the essential elements of ACHs. And so here you see that ACHs focus on a lot of stuff, from having a shared vision for the work to having really structured governance that can guide and support the work, that can steward this work, to having data systems. But one thing that's really important about the ACH model is that equity spans across these essential elements. And you see that in the center here. So I also want to know why we chose to focus on ACHs as the type of health-focused MSC that we wanted to learn from in this research. Because it's a particular type of health-focused MSC. But this really is from, Sue and I have both worked with ACHs, and Christina, like many people on the Phil team, have worked with ACHs since way back, since they first got started. And for me personally, this was exciting to see the ACH model. I started in Washington, and it was so exciting after having worked with collective impact initiatives for years and coalitions to see a model for multi-sector collaboration come forward that was clearly articulated and had the backing that is needed to do this kind of work. And so when we set out to do this research, we wanted to learn from a really promising example of what health-focused multi-sector collaboration could look like, and ACHs fit that ticket. And so I do want to note here that while our findings are most applicable to ACHs, the ones that we're sharing today are really generalizable to all health-focused multi-sector collaboratives. And so what we have been so fortunate to learn from ACHs, a lot of those learnings can be applied to other MSCs doing similar work. But I do want to put that into context. So there are a couple of things that are different about ACHs than just any given MSC. The first is that ACHs are community-based, and so they have a specific geographic area that they serve. This is not always the case for MSCs. They also have a staffed backbone function, so they have dedicated support that is like stewarding this work, and it is their job to make sure that this collaboration progresses and is successful. So that's, I think, a really important potential difference to note. And then the other thing is that so far, all of these states that have adopted the ACH model have some kind of state level support. That doesn't mean that ACHs exist across the entire state, but they do have that state level sponsorship and funding investment. And that is also huge. So now that hopefully everyone has a bit of an understanding of what ACHs are, let's also touch on this other term that you're going to hear me say a lot throughout today's session. And this is multi-sector collaboratives, or MSCs. And so MSCs are formed when multiple organizations in various sectors, such as hospitals, schools, local government, and community-based organizations, develop partnerships that take a systems approach to their work and are driven by a common goal and accountability to the communities they serve. And so we in Phil call this idea multi-sector collaboration, but there are a lot of similar ideas and terms out there for this idea. So you may have heard cross-sector partnerships or coalitions or interorganizational networks, collaborative governance initiatives, or collective impact initiatives. All of those are in some way embodying this idea of multi-sector collaboratives and multi-sector collaboration as our ACHs. And so that's the big idea that we're really getting at here and that we're trying to learn about, and that through this research, we've been trying to figure out, how do we do this better? So our overall research questions guiding this project were, first, how can elements of an MSC's local context and collaboration dynamics be combined, enhanced, or mitigated to increase the likelihood of achieving effective outcomes? The outcomes that we're most interested in learning about are cross-sector alignment, which sometimes we'll also call systems change or positive systems change, long-term sustainability of those collaborative outcomes, and also improved equity. And so related to that first research question, we also sought to figure out, when do certain configurations work for whom, why, and under what conditions? Let's see, here's just a quick overview of our methods. We worked with these 22 health-focused MSCs or ACHs, 9 in Washington, 13 in California. We were fortunate enough to have the participation of 642 unique individuals in this research project, many of whom participated in more than one way. And so we learned from those individuals through interviews and focus groups, through survey responses. We learned more about the ACHs and their communities through archival records, through meeting observations, and through contextual data like ACH websites and the American Community Survey. And we used a ton of different analytic techniques for the various reports and things that we've done. But for hypothesis testing, the primary analytic techniques that we used were structural equation modeling and theory testing process tracing. And so this was really a highly mixed method study, relying equally on quantitative and qualitative data. Now, this framework for aligning sectors is, some of you might be familiar with this. It was created by the Georgia Health Policy Center and the Robert Wood Johnson Foundation. And this framework guided how we investigated these research questions and how we've framed a lot of findings. And you'll see here that this is where kind of that idea of aligning sectors comes in. On the left-hand side, you see public health, healthcare, social services. In the middle, you see everything that these sectors need to do to get to alignment. You see everything from community voices to equity to financing, data. Around that is the local context. So everything that goes on in an MSC's environment, that influences everything. And all of these things, some mixture of this stuff eventually gets to outcomes. And so this is complicated. There's a lot going on here. And I hate to break it to you, but even more complicated is that we have all of these other theories and models for how multi-sector collaboration can and should work. And so here you see the two frameworks that were actually used to design this research project. And so one of our, through this research, we tested the framework for aligning sectors, but we used these two kind of older and a little bit more established frameworks to develop the research in the first place. On the left-hand side, you see the integrative framework for collaborative governance. On the right-hand side, you see the common framework for assessing ACHs. And again, you see that there's a lot going on here. There's so many moving parts. There's so many things that anyone doing multi-sector collaboration can and should be thinking about. And so what we are trying to do is to not focus on all of those things, to not run through all of the elements of any one framework or all of the many frameworks that you could focus on, but instead, we're acknowledging that there are so many moving parts to this incredibly complex work that y'all are doing. There are so many connections that you have to manage, and there are contextual factors. And so what works in your community might look very different than what works in another community in another state, or even just down the road. And so acknowledging all of that complexity, we wanted to, from this research, provide some guide of like, okay, there's all this stuff, it's all important, but if you're going to focus on one or a couple of things, what are those? How to prioritize your time and resources. And so that's what we're trying to do today. I do want to ask y'all to keep in mind a couple of really important notes that, as we just saw, there are all of these super important aspects of multi-sector collaboration that we're not going to be discussing today. We're not even going to touch on them. That doesn't mean that they're not important. They're super important, but there's just so much. And so what we're trying to do is to highlight what our research has shown to be the most essential things when you're seeking to improve population health through multi-sector collaboration. But since we are just focusing on a few things, I do want to make sure that y'all have access to some resources for if you want the whole shebang, if you want to look at all of the many moving parts and get the big picture, I would like to refer you to a handful of resources. The first is the Powering Change curriculum for MSCs, developed by Phil for MSCs as a guide for how to do this work. And so this curriculum is free. It covers kind of the major things that you should be doing and thinking about in multi-sector collaboration. And it points out to a bunch of other resources and guides. We also have links to those 3 frameworks that I flashed earlier. I'd encourage you to check those out, look at the related resources and literature for each of these. All of these things have just a plethora of good resources and knowledge for you if you want to do the deep dive. But today, again, we're not doing the deep dive. We're trying to keep things as simple as possible. And so let's dig into those 3 things to do when aligning systems for improved population health. The first thing is to include diverse and representative perspectives in decision-making. Second, use equitable and inclusive arrangements. And third, ensure the collaborative work produces observable benefits. So what we're going to do now is we're going to go into each one of those. I'm going to provide a really high-level definition of some of the key terms here. We're going to look at how these things were measured in Phil's research. We're going to talk about what these look like in practice, and then I'll close each section out with a brief overview of what our research showed that these things really influence and why they're so important. So let's start off with the first one, diverse and representative inclusion and decision-making. So diverse inclusion can be defined as intentionally cultivating a team or group that is representative of a variety of different individual traits, cultures, perspectives, and characteristics. The measures of diverse inclusion that we used include the extent to which the MSc engages ethnically and racially diverse communities and MSc activities, communicates effectively with the broader community about the MSc vision and activities, and engages the broader community to provide opportunities for public comment or participation. So what does this look like in practice? This could look like gathering information and perspectives from different people and communities to inform planning and decision-making in the MSc. For example, this might be community conversations or hosting world cafes. We've also seen this done as partnering with community organizations to field surveys or host focus groups, but to really learn from the community and ensure that those lessons learned are incorporated into decision-making. This could also look like including diverse representatives directly in decision-making. So one example of this is participatory budgeting, where the participants of an MSc actually decide where money goes, where money is invested, and how those investments are made in the community. And then this can also be done through intentional governance structures. I'll talk a lot more about this one next, but this is also important, making sure that the people who are intended to be served and benefit from the work of an MSc are at the table making decisions. Now, here I want to read a comment that Christina Olson left on this slide when she was doing a review that I think is just so beautiful that I didn't want to mess with it. So this comment from Christina is she wants to warn that diverse inclusion is not a check in the box activity. For example, putting one face of diversity on your governing board or doing one survey to gather community feedback does not mean you've done this. It is a continual and intentional practice of creating the right circumstances, environment, invitation, etc., to allow for and support diversity. Christina, I loved that comment so much and thought it was worth sharing with everyone. Okay, so the final thing on this of like, what's an example of how this is done in practice? And this is, a pretty straightforward one, but you'd be surprised at how often it doesn't happen, is making sure to engage in culturally and linguistically appropriate ways. So, for example, if there are a lot of Spanish speakers in your community, please make sure that you are making the materials that you are sharing out with the community accessible to your Spanish speakers. The list goes on here. But I want to point your attention to this great graphic on the right. This is an example of North Sound ACH in Washington State of how their community engagement plan is so multifaceted. And really, it's not just inviting people in, it's going out. It is incorporating people into decision-making. It is really acknowledging the complexity and depth of what this should look like. So next up, why is this important? We know that when working to change systems, we need all parts of the system to be represented for systems change to be comprehensive and effective. We've also seen that when you're working to advance equity, which is something that we in Phil care deeply about and was central in this research, that including diverse and representative voices and decision-making helps to ensure that systematically marginalized voices, people, communities are included in those decisions and that power is shared. And so what you see over here on the right-hand side is a picture of a highly complex statistical model that is showing how, and so each circle here represents a construct, an idea that we measured quantitatively using a bunch of different measures. And in the center, you have this main idea we're talking about right now, inclusion. And each of those arrows going into or out of inclusion show a direct, statistically significant and positive influence. And so here we see that inclusion, by the act of including diverse and representative voices in decision-making, that has a direct positive influence on levels of trust in multi-sector collaboratives. It increases levels of mutual understanding among participants. It increases trust, and it has a direct positive influence on perceptions of equity in the MSC. Here, you also see that there are a couple of arrows going into inclusion, meaning that there are other things that you can do that will help foster this kind of inclusion that we're talking about. One of those is having a really clear vision for your collaborative work. And the other one, and you'll see that big arrow there, which means that the relationship was even stronger, is arrangements, which brings us to our second thing, using equitable and inclusive arrangements. So arrangements are defined as protocols for managing the MSC over time. Some measures of arrangements that we use, these are the quantitative measures, include the extent to which the MSC engages residents who represent the community to inform the work, the extent to which they offer support and resources to encourage Indigenous communities, communities of color, and other historically marginalized groups who disproportionately experience health disparities to be active in the MSC, and the extent to which they make MSC events or meetings accessible to everyone and explicitly involve Medicaid consumers and community residents in decision-making. And so here you see that a lot of these arrangements, these measures, are like formalizing this idea of diverse and representative inclusion and decision-making. So these two really work hand in hand, or they can work hand in hand, and we would like to advocate that they should. So what does this look like in practice? A really basic one is just meeting practices. How do you bring people together? How do you steward this collaborative work? And so one thing that we've seen is offering multiple options for people to join is really important. And so I'd really like to encourage you all, as you go back to meetings in person, if at all possible, please keep adding that Zoom link. Please keep adding a call-in option. This is super important for people who might live an hour or two away from the meeting location and might have challenges joining for any number of reasons. So relatedly, rotating meeting location can be really important, especially for MSCs that are serving a really large area. So for example, there are ACHs in Washington that serve a 9-county region, so vast quantities of land. And so when you have something like that, it's really important to make sure that you're not always asking the same people to drive 3 hours to participate in the collaborative work. And then similarly, it's really helpful to ensure that the public knows that these meetings are happening, that they know that they're welcome, hopefully they are, and that they know how to join. And so having that just really openness to the public in some shape or form, we've seen is very important. Next is having formal agreements in place. You know, some people might think of these as being really stringent or not that fun, but you can bake in a lot of what you're trying to accomplish by having really thoughtful charters and memorandum of understanding and policies and bylaws. And so, for example, there's one ACH that has a partnership agreement, and they outline what it means to be a partner of the ACH, what it means to be a partner to the other partners, and what kinds of things are expected. And that helps create a shared understanding of what it means to be involved in this collaborative work. Now, similar to the formal agreements, you can use governance structures to really build this in to how you do work, build in, say, diverse inclusion and decision-making, or an equity focus, or whatever is really important to your collaborative work. And so one way we've seen this done is that sometimes ACHs might have designated board seats. So for example, in Washington state, a lot of ACH boards have designated seats for social services representatives, tribal representatives, community members, maybe a CBO seat, public health seat. And so really baking that in to how work is done. All over here on the right-hand side, you see an example of a governance structure of Better Health Together in Eastern Washington. And you see here that they have also, that they've used this governance structure to bake into how their work is done, diverse inclusion and decision-making. And so over on the left, you see that they have a collaborative that is dedicated to each of the 6 counties in their region. And those collaboratives not only meet individually, but they come together, they inform the board. And then in the center, you see these technical councils, where these councils, there's one specifically for community voices, one specifically for tribal partners. And these technical councils directly inform and liaise with the board. And so having a governance structure that builds this in helps make sure that it's not left up to chance. And so why is this important? You can see here from the quantitative work that having these arrangements in place has a direct positive influence on the outcomes of systems change and sustainability, with sustainability here being sustainability of those collaborative outcomes of, any good things that come out of an MSC. How do we make sure that those good things continue on? And then it also helps ensure equitable processes. And we also know from a bunch of research, Phil's and others, that equitable processes lead to equitable outcomes. Now, third and last, we have ensuring the collaborative work produces observable benefits. So benefits at a very high level can be defined as a good or helpful result or effect. And in our quantitative modeling, we kept this really broad. And our measure of benefits is the extent to which the MSC participants believe that working with the MSC helps their organization, tribe, or community achieve its own goals. And one thing I want to note about this third key ingredient is that this wasn't actually on our radar when we started off. We know that, having a value proposition is really important. We saw ACHs in California do a wonderful job of focusing on crafting that value proposition, and that's kind of baked into the catching model or the California Accountable Community for Health model. But this is something that so often, at least in this research and other things, we've seen as often overlooked. And it's kind of related to this idea. And so this makes me think of, I'm married to a K-12 teacher, and he, always gets this, the teacher thing where it's like, oh, well, you don't need fair pay. You don't need yada, yada, because you do this because you're in it for the kids. You do it for the love of it. And it's like, yeah, that's true. And the same thing in health-focused multi-sector collaboration, the same thing in ACHs. People are there because they care about the vision, they care about the goals. They're there to achieve something big, great, bigger than any one of them could achieve themselves. But it's also really important that along the way to getting to that 10, 20-year vision, that there are observable benefits along the way, that participants benefit, that communities benefit. This is something that isn't frequently talked about, but it's something that I would like to encourage we talk about more, and we make sure we're really clear on how people are benefiting from the work. People, organizations, communities are benefiting from the work. And so what does this look like in practice? We saw that there are just a ton of different ways that people benefit from participating in multi-sector collaboration. One of the things that we heard over and over again is that people valued the opportunity to connect with other people and organizations doing similar work, that this kind of connection led to new projects, new activities, new collaborations that never would have happened if they hadn't simply been there in the same space together, understanding what each other were doing. We also saw that through this, people were able to share resources, whether that be data or ideas or events or training, like knowledge that they have that other people can benefit from. We saw many ACHs developing new resources. And so this could be a community resiliency fund, like you see here on the screen, or a community information exchange, or everyone coming together to fill the survey or host community conversations. And so really developing new things that no one person could have done alone. And then we also saw over and over again the importance of dedicated support for aligning efforts and how participants saw this as a huge benefit to participation. And so many MSCs, so again, remember ECHs have a backbone organization that is staffed, and those staff are in and of themselves incredible benefits, incredible assets to communities, to the people who participate in multi-sector collaboration. They provide training, they provide facilitation, they bring people together in convenings. There are examples of helping with grant writing or bringing, like identifying, doing matchmaking for applying for grants, matchmaking for projects, like the ways that this dedicated support provides benefit to participants are nearly endless. And we just saw over and over again how beneficial this is for MSC participants. And so what does this, why is this important? Why does it matter? One of the really important things is that this kind of benefit, if there are observable benefits in MSCs, this builds the commitment among MSC participants that's needed to sustain this collaborative work. And so, you know, when we think about sustainability, a lot of times we think about money or leadership, and that's all super important. But we also know that having people committed to the work, showing up day in, day out, volunteering to take things on, that is incredibly important. And that people are going to be more committed if they are in some way benefiting from the work. We also see from this nice little model on the right that this idea of goal attainment, that people are benefiting because participating in the MSC helps them achieve their own goals, that this idea has a direct, positive, and statistically significant influence on all three outcomes that we were interested in this research: equity, systems change, and sustainability. So that was a lot of information. I'm going to close out with like a couple of kind of, I don't know, ending reflections on some of these things. And then I'm going to pass it over to Christina, who's going to lead us in kind of questions, a facilitated discussion. But I do want to ask if there are any burning questions out there that we should make sure to address before I move into kind of summarizing all of these findings that I just shared.
Stephanie, I am going to take a first stab based on some of the things in the chat real quick, just so we can circle back on a couple. So I know that when you started with the secret sauce, that first item talks about including diverse and representative perspectives in decision making. Can you share a little bit more about what that diverse term means? Somebody in the chat was asking a little bit more about representation of different ages or demographic groups, students, elders, parents, grandparents. Like, what does that mean when you talk about this secret sauce component?
Yes. Okay. So this is going to get into one of the things you'll quickly learn is that each one of these, we tried to simplify, we tried to make these three things, we tried to make them as simple as possible, and each one is incredibly complex. And so when we talk about diverse and representative inclusion and decision making, that diversity should reflect your community. And so that means we're talking about race, ethnicity, age, gender identity. We're talking about if you serve a city, that you should have the different neighborhoods represented. If you serve a region, you should have the different counties represented. If you are in an area where you share land with tribal nations, there should be tribal consultation. There should be invitations ensuring that they're invited. Ability, disability, you know, like as broadly as you can think of diversity, and especially, I mean, look at your community, look at who makes up your community, and think about is my MSC table, are the people who are making decisions in our MSC tables, does this reflect my community when I look around, when I walk across neighborhoods, counties, whatever you're serving? And so I apologize that that's not a simple or straightforward answer. It is asking you to do hard work. And it's asking you to look at your community, to think about what are the different diversity of perspectives that are present in your community, and recognize what diversity and what representative diversity looks like in your unique context.
That was great. Thank you, Stephanie. I'm going to pause because I want to see if anyone wants to unmute themselves, but I'm happy to field other questions in the chat as they come up.
Marcy, I see your hand raised.
Yeah, thank you. I had a question in the chat and I was just hoping it could open up for a little discussion because I always learn more when I listen to other people talk. As a local health jurisdiction in a very northern rural county where we have huge equity issues, we should have our strategic plan completed by January. And it's we've actually had amazing input. We're aligning it with our general plan update. So it's going to be really amazing, but it's only going to be as good as we can implement it. So we have a really strong, by virtue of necessity, collaborations with jail health, jail, with our CBO, there's only one. We have a health systems collaborative with our health partners, our managed care organization. The key thing that I keep coming back to as a public health executive is funding.
Yeah.
Are there any counties at the local health jurisdiction, not CBOs, because we have one, they would also be funded or integrated, that have developed like a trust? We have intergovernmental transfer dollars that we could use for that, because we have to have a source of funding for partners that are going to implement strategies to address the equity issues. That's it. Thank you.
That's huge, Marcy. And what I would like to ask is if everyone who is with us today can think about Marcy's question. And I would love to open it up to the group. I have some ideas. I know that there are examples out there, but I'm wondering if anyone here is able to share some really good examples from your own perspective and experience. And since that is a discussion, I'm wondering if I can wrap up my couple of slides here, and then we can move into full-blown discussion and just talking with each other. Does that sound okay? Christina, is that good, or is there something I'm missing before we hop back to Marcy? Okay, Marcy, that is a fantastic question. Okay, so everyone, please be thinking about this funding for this work, and if there are trusts, sustainability from that funding perspective. Okay, so I just have a couple of closing reflections to touch on. The first is that diverse inclusion, as Marcy just alluded to, requires dedicated resources and intentional trust building. And so these dedicated resources, like this, doesn't just happen overnight. It doesn't happen while we're sleeping. It oftentimes requires dedicated staff, dedicated funding. It requires time. It also oftentimes means not just like inviting people in, but it means going out to where the people that you want to be involved in the MSC, going to them, not just always saying, please come to me. But what we also saw through this research is that diverse inclusion is tricky. It's super challenging, not just because of the dedicated resources that are needed, but when you get a lot of diverse perspectives in the same room, a lot of different lived experiences, that there is going to be most likely some sort of conflict and maybe even misunderstanding. And so to mitigate that, or I don't know if mitigate's the right word, but like to build on that, you need to do some intentional trust building. And that if you do this trust building, if you get to a place where you have a high level of trust and a high level of diverse inclusion, that is going to be really just the key to making sure that diverse inclusion is exponentially beneficial for your work. I also just want to, I think I mentioned this earlier, but just return to this idea that arrangements can be used to intentionally shape collaboration, which helps ensure that outcomes aren't left to chance. And so this is really your, if you have a lot of turnover in your MSC or in your agency, this is one of those things that can be used to help ensure that the mission of your MSC is actualized and it's not left to who's in charge today or tomorrow. And then I also just want to make note that benefits can manifest at the participant level and move to the population level. And so oftentimes, it might start with a small CBO receiving a training through the MSC, and then they're able to take that training to other CBO partners, or they're able to apply that training and when they're serving the communities that might be systemically marginalized that they're serving. And so this is how those benefits can move from the participant level to eventually that population level and create population health improvement years down the line. And then I just want to note that this dedicated support again and again is so important. That there are communities that are doing this work without dedicated support, without a backbone organization, and that is incredible. But through this research, we have seen that having that backbone function or a network leader is just really important for making sure that these three things are able to be done and that they're able to be done well. And it's still hard. I mean, even if you have dedicated support, these things are still hard. So let's see, my final thing here is I also just want to note that aligning sectors also often isn't enough. And so you might recall from that framework for aligning sectors that it's really focused on public health, healthcare, social services, and those are super important. We know that if we want to improve population health, we have to have these three sectors at the table. But what you see in this mess here is that it can't just be these three sectors. It is everything that goes along with that. And like social services is huge. There's so much involved there. We have business. And we should also see local, state, and federal governments involved. We should also see tribal nations involved. And we need to make sure that communities and the community members are involved in this work. It's not just about organizations and organizational sectors. Okay, so the final thing before I hand it over to Christina is just to let you know that we just released a brief series yesterday that digs into each of these ideas in more depth. So if you want to go and eat your heart out on this stuff, please check out this brief series. I want to give a huge shout out to the Merlin team at Phil, who just helped to simplify and consolidate literally hundreds of pages of findings to get to these 6 briefs, and also the communications team and Phil. Becca, Katie, you all did just an amazing job making these beautiful and accessible. And so I hope for all of you joining us here today that you'll go and check them out, because the team really just put a lot of effort into this, and I think they turned out great. So that's all from me. Christina, over to you.
Thank you so much, Stephanie. I see, Bernice, you have your hand raised. I am just going to pause 1 second and then I'll jump over to you. I do want to share, I think that I'm seeing a lot in the chat. Thank you so much for engagement of those who are kind of responding and making connections across multi-sector collaboratives, talking a little bit more about the how. I know that Stephanie has shared some really huge concepts about the what that should be done. And I know that this is a lot to digest. And so just want to encourage you all to continue joining this series of conversations. We know that, 1 hour of time is not going to be enough to cover all the content that you all might be interested in. And so I am just going to throw out that teaser for round 2, the second part of this series. We will be bringing panelists from multi-sector collaboratives who are going to be here to really share a little bit more about how they are actually doing these secret sauce components, to give you some really concrete examples of what that looks like at different levels, because there is no one perfect solution for the how. It really depends a lot on local context. So just want to encourage you all to continue coming back, to continue sharing in the chat, asking these really challenging questions. We appreciate those opportunities for you all to connect and hope that you find value in the continuation of the conversation. But real quick, I do want to ask Bernice, I see your hand is raised. I want to make sure you get a chance to chat in here since you've been brave enough to raise your hand. So thank you.
Thank you. I just following up with my chat and wondering if anyone has some golden nuggets. We're working on a regional approach, also like Marcy, and are bringing different community partners, promotores, city, county offices, potential funders, and are collectively, we're seeing that promotores align with their respective CBOs, right? Despite kind of the training and the inclusion and all of us being together. And I think that's really normal. But we're having some big meetings, and they themselves are starting to advocate that instead of having one lead CBO help organize or be the backbone of that ACH, that we collectively start something new where there are seats for each of their CBOs. And unfortunately, that's new for me, right? We always have leaned kind of on a lead community-based organization. Historically, our region has been very underserved and compared to our sister cities in our county. So there's a lot of pain to overcome and a lot of healing to be had, which I think and we think is part of why they're asking for something new. And I'm just wondering, maybe at another point, if anyone can write down my email, I'll share it. If just have some ideas about that, or how to move that when the community is asking no. Like, our CBOs were impacted. We all kind of have siloed efforts. We need something new. And where do we go from that? Thank you.
Thank you so much, Bernice, for just sharing that and really looking for connection. I appreciate that. And I know that there are probably others on the call that might have some responses. So if anybody would like to share or just put your information in the chat to connect with Bernice, I know that there are a lot of sites struggling with similar issues and may have advice or ideas for how they've overcome challenges. So definitely hoping that you all are able to make those connections. So I think we had some ideas about how we might digest. One of the important things that we do at Phil is not just show the action, but think like reflectively. So we go through this process of like, okay, all this information has been presented to us. Let's spend a moment here in reflection. So what I'd like you all to do is really, oh, and I see a comment here in the chat about would love to talk. So yay, thank you for those connections. But what I'd like to do for a moment is just have you all think on potentially, what are you already applying? How are you already applying any of these three secret sauce elements? You know, we presented a lot of the what needs to happen. And so we're going to actually just reflect real quick on item number 2 for the sake of sharing, connection, and idea generation. How are you already applying, again, any of these secret sauce elements in the work that your multi-sector collaborative is doing? And actually, maybe we could go back to that slide with the secret sauce elements, if that would be helpful for folks. And if you could just add in the chat, that's slide 19, I believe, team. So if you could just add in the chat any ideas about how that might look for your site. So I'm going to open that up, think about it, start adding in the chat any of those. You can connect it to one of the numbers if that would be helpful. And if anybody wants to just raise their hand and speak out loud, we would love to hear that as well.
Hi, Christina.
Christina,
Yes.
sorry.
No worries. I heard a couple people voices speak up. Go ahead and unmute yourself. Someone, you're welcome to share.
Christina, I wanted to respond to Bernice and perhaps to many other people on the call with a comment I made in the chat. Sometimes it's hard to follow the chat or people just can't do so many things at once. I'm suggesting that it might help to acknowledge that this type of community organizing has been going on for decades, at least some in many places. So perhaps if you're encountering, we're not going to come until there's a plan, we're not going to come until there's money, we're not going to come and look unless the following, maybe start with the question, what would new look like to you? What is it that they have in mind when they say, we're not going to do this because? I'm just wondering if that kind of start would make sense instead of trying to persuade people how important this is or talking about value propositions. There are always going to be groups and people and leadership in pre-existing organizations that just aren't going to buy your value proposition at all.
Thank you for speaking up. I really appreciate that.
Love that comment, Lucy. That's a takeaway.
Thank you. Glad I'm here.
Christina, could I just add something? I mean, that's what, when I was listening to Bernice, that was my thought is, I think it's really about how in this work that we're doing, do you invite people in, but create the conditions for that type of dialogue that you're speaking to. And I think it's Lucy. I heard Marcy mention Lucy. I just see Elle, which is, I'd love to talk more, not necessarily today, but yeah, like we use a practice called backcasting, lots of practices, right, where you really invite people in to think about what would that future look like and then work backwards. So love what you're speaking to.
All right, so I haven't seen a ton of additional comments come through in the chat, which is totally fine. Sometimes we have more chatter and not. Again, if you have any ideas to share with your colleagues on how you all are doing these 3 secret sauce elements within your own work, feel free to drop that in the chat. Again, we're here to really foster connection, help people see that. There will be more conversation on that in event 2, but I do want to turn it over to Sue, our director at Phil, to share a little bit more exciting news about the things we have in the pipeline to be able to support multi-sector collaboratives more effectively.
Oh, I have to mute myself. You would think 3 years in, we would all know. So we have collectively inside of Phil and also in our work done a lot of work in this space of multi-sector collaboratives, worked in ACHs and a variety of others. And we by no means have it all figured out, but what we feel and observe and have heard, particularly in this work, is the need for people to be in dialogue and learning about how to do this really hard work. So we are launching, this is national, it's not just California, right, or Washington, this multi-sector collaborative innovation network. And it's really a space where people can come together to talk about these issues that are really challenging and not just hear from us, but hear from each other. So creating a space for nurturing and learning. So we're excited about that. And our first attempt, right, of bringing this up, we're calling it Fill Up Your Cup, a little play on words here, right? And there is this, this notion of third place. I'm not sure if any of you have ever heard of that term. And for some people, the first place might be home. The second place, right, that they're in and, going to, right, could be work, unfortunately. The third place is a place that we create that allows people to put aside concerns. It's safe, but you're really just enjoying the company and the conversation around you. So we really want this to be a shot of espresso, right? And we are starting with just 30 minutes, right? Like we want to hear from you. What are the topics that you want? Because we want it to be not a big investment of your time, at least initially, but really this is about supporting you all. So our first event, right, that we're hosting is July 13th from 2 to 2:30. If you are interested, I think you'll probably hear more over the course of the next 2 series. This is all new and evolving for us, but just wanted to announce it today. And then this is, right, just to remind you, we are not done, right? This is the first of our 3 sessions. So today you've heard about what are the top 3 things to do when aligning. The second session that we are having is on June 7th from 10 to 11:30. And this is where we're going to have a panel of 4 different, 2 from California, 2 from Washington, really diving into those 3 things to do and giving very concrete examples. And then part 3, we love to collect information. So we've curated lots of examples, lots of data. And so that one will be focused in on the lessons learned, that we have from this. And then of course, because you can't get enough of us, right? July 13th, we hope to see you and help to co-create a space that's really going to work for you and that has value. Fill up your cup. So, and there is, I think maybe, oh, good. Becca put in the link to the evaluation, but also if you're very handy with your phone, you could use this QR code and go right to it. Okay. I think, Stephanie, any last closing?
No, thank you, Sue, for stewarding this work. Thank you all for doing this work.
Great.
And joining us today. Really appreciate it.
Great. Thank you so much for coming. We appreciate it.